Okay, well, it just turned 1 o'clock, so I'd like to formally welcome you to our Renewable Energy and Health panel discussion as part of the Renewable Energy Summit. And I'm joined here by some wonderful speakers, so I think this is going to be a really great session today. Healthcare providers are shifting to renewable energy as part of their commitment to healthcare. And today, our speakers will discuss why health experts are weighing in on the importance of renewable energy to protect health. Before I introduce our panelists, I'd like to remind you that at 2 o'clock, we will have our last sessions of the day. They're called industry conversations. And among the conversations that's happening at 2 o'clock are 5 different sessions, 6 different sessions, including something called The Next 10 Years on Large Scale Renewables, Energizing Rural Electric Co-ops, Ask a Solar Installer, and Energy Districts, a model for significant clean energy adoption in communities, and technical education to meet workforce needs. But the final session at 2 o'clock is hosted by the Wisconsin Health Professionals for Climate Action. Dr. Andrew Lewandowski will actually be continuing the conversation we're having here. So I have a feeling we're going to have more questions than we have time for, and so much content to talk about the intersection of health and renewable energy. But if you're interested, you can definitely stay on until 2 o'clock at the 2 o'clock hour and continue the conversation on health and renewable energy. So I just wanted you to have that in the back of your mind as we get started. And so without further ado, I'm going to begin by introducing our first panelist, Claire Gervais. Claire is a family medicine doctor in Madison who's actually taking care of patients just today and last night. So she's very, very busy. We're very lucky to have her. She's caring for patients from birth through the span of their lifetime, and she has a special interest in environmental health. She's the co-founder of the Healthy Lawn Team and the Wisconsin Health Professionals for Climate Action. And she plays a leadership role on the Wisconsin Environmental Health Network. She's currently working with the Sustainability Management Team at UW Health to work on renewable energy options. So Claire, I'll turn this over to you for your introductory remarks.
Well, thank you. I'm going to attempt to share my screen.
It's looking good.
Let's get on the right slide and then we'll do this. All right.
Perfect.
So so I'm Claire Gervais. I'm a family medicine doc and I do OB. I was just telling everyone about my latest adventures with the OB. And I'm with the UW Health Department of Family Medicine and Community Health, and I'm the Secretary Treasurer for Wisconsin Health Professionals for Climate Action. Why is it that, we're involved as physicians? Well, everyone knows that climate change has a significant impact on human health, and that's where we, what we lead with. That, you can see, you've probably all seen this slide before of all the impacts, which I'm not going to go into, but I just wanted to show this as kind of the reason why healthcare providers should be involved, why health professionals should be involved. And so as a result of all of these impacts of climate change, Wisconsin Health Professionals for Climate Action formed because there's a lot of health professionals, including nurses and pharmacists and physicians who are interested in making a difference. The other piece of this is that healthcare facilities themselves contribute to climate change. It's been estimated that we're responsible for 10% of the US contribution of that, and for many different reasons. So, not just energy use, which is a big part of it, but anesthesia gases, waste, where we get our supplies and materials from and what they are, our vehicles, and the food we eat. Meat and dairy have an impact, and where we get our food from and what we eat contributes, and just how our employees get to work. So all of these things contribute and have a huge impact. And so we're trying to do something about that. So our organization is very much paired with the Global Health Institute and working together here in Madison on a number of initiatives. And this is an initiative that the Global Health Institute put out, alerting people that climate change is harming our health in Wisconsin. And just so you have an idea of, what renewable energy could do for us, here's the estimates from it's a study that was done in February of 2019, trying to estimate the amount of health impacts there are in Wisconsin as a result of air pollution, fossil fuel burning. And you can see there's a lot of potential there for renewables, which is why we're interested in pushing our healthcare facilities and other and people to be aware of this, so that we can actually move toward that, as soon as we can. So here's our website. I just want you to be familiar with, if you want to look us up. Here's our website, and then here is a page from our website on some of the work that we do. And I'm leading the Decarbonize Wisconsin Healthcare, or we call it Climate Smart Healthcare team. And I'll tell you more about that in the question and answer session. But this is just an introduction to some of the work that I'm doing with others in our group. So with that, we'll go on to the next intro.
Thank you so much. Thank you so much, Dr. Gervais. And next I'd like to turn to Allie Wolf from Aspirus. I'll do an introduction for her, and then she'll share her slides as well. With a vision to improve the lives of Aspirus. Sorry, just knocked off my laptop. With a vision to improve the lives of Aspirus patients and the health of Wisconsin and Michigan communities, Allie leads the strategic implementation of sustainability initiatives across $1 billion rural healthcare organization. She's experienced in commercial construction management, and she spearheaded the design, implementation, and ultimately the execution of one of the first LEED certified buildings in central Wisconsin. She managed the strategic portfolio for 72 sustainability projects, including a number of solar installations over the last 3 years. And I'm sure these numbers are continuing to grow, but so far the Aspirus system has realized nearly $800,000 in energy savings and offset the annual energy use of about just over 1,000 Wisconsin average homes since their work began in January 2018. So without further ado, thank you for being here, Allie. Go ahead and share your screen if you're ready.
Thanks for having me. Okay. Are you seeing the way that you would like this to roll?
Yeah, go to the swap just above where you were. Yep, go to swap up. Yep, perfect.
Very good. Okay. So thank you guys for the opportunity to gather today. I just want to give you a little bit of an intro for Aspirus Health. We are a nonprofit health organization across Wisconsin and Michigan. We have 87,000 employees, 8,700 employees. That would be a lot more. And as you can see in the map here, we've got hospitals and clinics across our spectrum there. And I think the big thing that I just want to highlight in our conversation at this point is our mission, and I'll weave that back into our conversation in a bit. But Aspirus's mission is that we heal people, promote health, and strengthen communities. So the last couple segments have been talking about the importance of clean health and how clean energy and how that impacts health. And I think we've maybe not isolated healthcare and ever understood what that looks like. So we have very, very energy intensive buildings that we need to deliver the intensity of the types of services and equipment that we have. So it's understandable, but I don't know that we understood how much energy we actually need to deliver that. And certainly when we isolate that and look at that spend and then the associated greenhouse gas emissions, I think we start recognizing like, shoot, we're here to deliver health and to bring people forward towards a stronger community. And the way that we're going about that is something that we can do better. So this is an image that you guys just saw, and this is really the impetus for Aspirus as a whole. We started understanding this and recognized we need to shift the way we go about our business so that we have the ability to really fulfill this mission. Okay, so we've organized as an organization around these three goals. We started about 3 years ago, and we have a carbon reduction plan, which is really only looking at scope 1 and 2. It doesn't mean that we aren't doing something with scope 3. We are trying to influence that. It's a huge opportunity for us, but we are only measuring scope 1 and 2. So I hope that makes sense. We've obviously been doing a lot with energy conservation as well to support the business component of that. And then our last goal is really looking at Practice Green Health, which is actually affiliated with Healthcare Without Harm. So our goal is to be an 80% reduction of carbon by 2030, a 50% reduction on our energy conservation, and to fall within the top 25 percentile within Practice Green Health by 2030. So once we understood what this issue was about and senior leaders got in line behind this vision and this idea, we needed to establish what's our purpose. And this group meets monthly, and we've got a number of projects that we meet on, identify the goal, and then look at our milestones throughout the year to ensure that we're on track and ultimately hold each other accountable. Okay. So these are some of the specifics of the areas that we have projects being stood up. Many of these areas we have been doing things for the last 3 years. If I had to isolate any of the areas that we are sort of just starting, or we have a much longer runway to do more with, that is our supply chain, community health, and then transportation, which we'll talk about in a moment. So as we look at all of these projects, we have a scorecard that helps us look at the end of the year, we know where we started and we know where we are now, but how do we measure that in a way that's something that's just beyond the business component, but also think about the impact of people and the impact of planet. So in order to do that, we need a lot of data. So within our program, we have a lot of data that we need to try and help bring forward and tell our story. But I think one thing that's been really, really powerful, and that was just spoken about, is the importance of how our reduced energy use and the energy savings that we have impacts health. So being able to use that calculator from Practice Green Health and Healthcare Without Harm has been really a powerful thing for us. And it's been important to be able to tell that full story that I think intuitively we all know, but we haven't been able to measure it in that way. The image on the right is actually demonstrating just a scorecard that we get annually from Practice Green Health. It's our benchmarking that helps us understand how we're advancing things at each hospital. And we were successful in being recognized last year at 3 hospitals, which is wonderful. And we have intention of pursuing additional, being that we're only in year 3. So with that, knowing this audience, wanted just to give visibility to that carbon footprint goal that we had. So let's be honest, when we set that out, that sounds great, but I think it was hard for us to say, what does that even mean? How are we going to do that? So we were lucky enough to have the gift of partnership with HGA that helped us understand, if this is the target of 80% by 2030, how would we go about actually getting there in a year-by-year perspective? So That was extremely helpful for us. And given that, we've had an understanding of how fast we're moving and on what with our renewable energy portfolio. So this is just an example of some of the work that we've done over the last 3 years. And we're not quite to a megawatt yet, but we are close, which is great. And we had the opportunity to move towards an electric vehicle, which is our first in our fleet of 120. So great opportunity for us to move in these directions. Lots of work to do yet. So with that, just wanted to give somewhat of an intro to Aspirus Health, and then also why we've moved in this direction and how it aligns with our mission. So.
Thank you, Allie. And I should say just that I really enjoyed meeting you on a rooftop of one of your solar projects at your ribbon cutting. It's a fun way to meet people on the rooftop.
For sure. Yeah.
Okay, so now we'll go to our third panelist, Jeff Thompson. Dr. Jeff Thompson, the former CEO of Gundersen Health Systems, is a pediatrician and the author of Lead True, Live Your Values, Build Your People, Inspire Your Community. Jeff was CEO of Gundersen Health System for 14 years and responsible for improving quality, lowering cost, and advancing care into the community. He served a staff of 7,000 with hundreds of thousands of patients and yearly spent $1 billion of the community's money. His long experience as an intensive care pediatrician and senior executive has shown him how leading from one's values can affect tremendous lasting change. During Dr. Thompson's tenure, Gundersen Health System developed an energy program that decreased greenhouse gas emissions by 95%, decreased hazardous pharmaceutical wastes by 98%, and did those in a fashion that decreased the cost of care and improved the local economy. Gundersen was repeatedly recognized nationally for excellence in quality and cost effectiveness. It has earned HealthGrade's highest honors, America's 50 Best Award for 2012 through 2016. Dr. Thompson also received the White House Champions of Change Award in 2013. Thanks for joining us, Dr. Thompson. It's great to have you here. Oh, we've got you on mute. I think we still have you on mute. Let's see.
Okay.
There you go.
Oh, I know. The host button on me. Okay, so, well, that's actually quite enough about me. And so there's probably no more to say, and we should probably give it over to the other folks who are much more interesting. My background, as you pointed out, is a pediatrician and then eventually the CEO of a health system. I would like to kind of put it together with what Claire and Allie already did. Currently, I'm a co-board chair of Healthcare Without Harm and Practice Green Health, kind of twin organizations that are all part of a same broad group. These groups, Practice Green Health has over 1,000 healthcare hospitals and organizations in the country that have committed to working on some part of improving their sustainability footprint. Healthcare Without Harm broadly has 35,000 organizations across the world that have participated with them in over 50 countries, is one of the major organizations across the world that has tied loose ends together. Like Claire, who is working with health professionals from many different backgrounds across many places in the state, it's an important piece to tie together those various members from different backgrounds who are working for the same common goal. So we all don't have to be the same. We're better off if we're not, but it works well to move along political agendas. It works well to move along educational agendas, and works well to move along staff and help them see what's happening in other places. So Healthcare Without Harm and Practice Green Health serve as a resource to people at all stages of their journey. You're just starting out, you haven't even thought about things. It's a great place to be. There's so many resources to get involved with, many other people also starting out. People that have done a lot of work like Allie and Aspirus, I mean, that is a lot of work in 3 years. That is a lot of work. Many places do not get that far that fast. That's impressive amount of work. And then the people that have had much more experience, Kaiser Permanente, for example, has been on this journey for 20 years. They're one of the most active people in Practice Green Health because they're still learning, and they would still tell you they still learn every time they host or become a part of a meeting. So I think the combination is what's going to make this movement so strong. Our focused activity at Gundersen started in the early 2000s. We started working on some things, and in 2007 or 8, we really codified the work and said we need to not dabble. We need to set goals, like Ali put up the goals for 2030. We set a goal to be 100% powered by renewables by 2014. So this was in 2008, which was absolutely ridiculous because, of course, immediately after setting that goal, we had the economic downturn. So that wasn't so clever. But we decided we would do that. It does not include the scope 3 issues like Ali pointed out. But we said we would do that, and we framed it much in the same way. We framed it not about polar bears and ice caps. We framed it as this is about health. This is about all the things that Claire went through and Ali mentioned. This is about health of our population. Is it okay for a health system who claims we're trying to improve health and well-being of our patients and communities to put 450,000 pounds of pollutants into the atmosphere every year? Is that okay? And you stare the board members in the face and say, you really think that's okay? Of course it's not okay. Blah, blah, blah. Okay, so are we going to do something about it? Well, I don't know. It'll ruin our finance. Can we do something if it helps our finances? And so that's how that argument went. We said if we can lower the cost of care, if we can improve the local economy, if we can decrease our impact on pollution so it improves health, are you okay with us going ahead? And we did. And something that I think has not been talked about as much at this conference because it's not its focus, but anyone starting on this journey still has to start out at efficiencies. I mean, before you start planning your giant solar panels and your wind turbines and your geothermal, you should start with decreasing your energy use. You should start with improving efficiencies. We started there. We spent $2 million on efficiencies. You say, oh my goodness, it's crazy. Yeah, we've made 60% return on that money every single year since 2009. 60% a year since 2009. That's a tremendous return. And that helped paid for many other things that we got to do. Is it exciting? I mean, you almost never have, back to Heather's point, you never have a ribbon cutting when you change out a 1 horsepower motor for a 1/4 horsepower motor in the 3rd basement of the hospital. I mean, that's not very sexy. That's pretty dull. And it's actually stinky down there. So we don't ever do that. But that's where the money, there's so much money there, and controls on the walls and all these very boring things. So much money. And it decreases the amount that you have to put into your solar and your wind and your other renewables to do. So we started with efficiency. We drove on to these other pieces. We changed the overall efficiency of our buildings by 59% in 6 years. 59% improvement in the efficiency of our facilities so that we didn't have to put in as much renewable energy. Of course, the CEO was a knucklehead, and we had to build a replacement hospital in the midst of all this as well, which caused problems, but also opportunities. Maybe we'll talk about that a little later. So my point is, we have many groups out there we're willing to partner with. we partnered with so many different folks. Is exactly the right thing. And health professionals, the group that Claire works with and others, are so important to move this along and remind people what we're about. And for people that haven't got started, all you need to do is look at Allie's group. I mean, 10 years ago, they were doing hardly anything. Now, in the matter of 3 to 5 years, they have this robust program that is changing lives and showing many other people that you can improve the health of your community and decrease pollution and make money doing it. So this is these are terrific examples of how we can get from where we're at to where we need to go.
Thank you so much. That was great. We like to joke that we're noticing a trend in general, not just health systems, but anyone who's working on energy issues. Renewables, because they're visible and they're fun to talk about and they're great to look at, can actually be a gateway to getting your whole energy system, to getting interested in energy. And we know from a practical perspective, it makes a lot of sense to do energy efficiency first. But, I'm a homeowner and I put solar on my home before I did anything else in my entire life about energy, really. And I got these solar panels and I looked at them and I was like, those are fun. People asked me about them and like talking about them. And then I started doing insulation and all sorts of other energy efficiency things. Now I love, I want to get a heat pump hot water system because different people need different points of entry into the market and to learn about energy. And so whatever your gateway is, we're happy to have you. But absolutely, energy efficiency can be a very important tool to help save money so you can do solar panels. So I'd like to jump into questions, and we have a great audience here. Thanks for joining us. Please put your questions in the Q&A so that we can ask the questions that you're thinking about. I'd like to start with a question for Claire, actually. How does the disparate burden of climate and energy impacts play out in your patient populations and communities?
Yeah, I'd like to start to, I guess, acknowledge and start with equity in answering this question, because there's some communities that are affected more than others. People of color, Black and brown people, low socioeconomic status, poor people, elderly, infants. Some people are affected more than others. And so I'll give the example of extreme heat, because that's one of the most significant things that we see in Wisconsin and other places. And in fact, kills more Wisconsinites than other weather disasters, which includes like blizzards and floods and tornadoes. And in fact, kills more Wisconsinites than all of those things combined. So when you're looking at those vulnerable communities, there's problems with finances, having a working air conditioner, or having the power turned on. I've had to write letters for patients to keep their power on so they can have their oxygen, for example, and have their air conditioning. Those are those vulnerable communities that we care for. And a lot of these communities are located in urban heat islands. If you're not familiar with that, in the depths of the city is where a lot of these people are located for a bunch of reasons. And the temperature can get up to as much as 20 degrees more than the rural areas. And so when it comes to heat, that's a huge issue for certain populations in particular. These are also populations that are more likely to be located near coal-fired power plants. And so we have more issues with those people being exposed to pollutants. And the way it affects people is it worsens their chronic disease. I mentioned people on oxygen for reasons of having emphysema or heart disease, that type of thing. There's also a lot of people that have allergies, and with climate change occurring, There's increased pollen because the plants that create the pollen are more stimulated by climate change. And I won't go into the pathophysiology of that, but allergies are getting worse, going up, into Canada. Pollen counts are getting higher. And so these are some of the things that we're seeing. Also, flooding is an issue in Wisconsin in particular. And we see both the physical burden of that. I had a patient who injured his back just moving furniture, out of his basement, trying to, get things out once the flood had occurred. And then you got to worry about mold growing in those basements and causing more issues with allergy. The loss of homes, the losses themselves, and the stress of even thinking about climate change all plays a significant role on people's mental health as well. So those are just some examples of what we're seeing with our communities in Wisconsin.
Thank you. That was very informative. Jeff and Allie, would you like to weigh in on those impacts?
I think the only thing I would potentially add in thinking about burden in general is, when we think about energy, 90% of it at this point, we're importing. So I'm thinking about the business health aspect of that, right? And how when we're not thinking about local clean energy, how is that going to impact our local communities? And how is that going to impact our state as a whole? I know that that's not a direct relationship to this question, but I think about, health of community. And I also think about, do we have livelihoods that we could be thinking about investing in and pursuing that way as well?
Let me just add to that Wisconsin spends around $14 billion a year importing coal, oil, gas, and other fossil fuels to power our transportation and our energy generation. So if we even generated half of our energy from renewable energy, half of our electricity from renewable energy, we'd have billions more dollars circulating in the Wisconsin economy, which could be reinvested in local businesses and supporting local communities. So yeah, absolutely. There's an economic impact. Jeff, go ahead.
Well, so you take your half and you become 20% more efficient, and then you get half of it from inside, and now you have a great boost to the economy. As Claire was pointing out, with heat, with floods, with all these stressors, economic stressors on top of it. Now we have a pandemic. The poorer communities consistently get hammered worse. Every single time they have less resources, they have less capability, they have a less of a voice, and that is just going to be a chronic problem that we can make a huge improvement in if we can turn this around and take some of that 14 billion and have it available for better housing, better food, better mitigation strategies, better education, all those things.
Yeah.
I think that it is not a minor issue, and it's all tied together. And we can, once we start putting this together as both a social and economic and a long-range plan approach, we can see how it can really make a difference on health and social equity.
Thank you. I have a question here in the chat from Jeff Rich. Thank you, Jeff. He's asking, what policy changes at the state would help you the most to achieve your goals as healthcare systems? I'll start with Allie with this question, if that's all right.
So I would normally be asking Jeff this question. So I'm not going to know all the numbers and FERC and blah, blah, blah. But what I do know is that any way that we can have the opportunity to participate as a partner, or potentially have more opportunity to backfeed our own buildings, would be an ideal circumstance for us. And I think that we've got a lot of limitations right now in participating in some of those programs. Many of us are nonprofits, so there's the tax appetite is not there that's necessary. So I think that that's also a hurdle. So that's not a very good answer, Mr. Rich, but I definitely understand that it's a hurdle. Potentially Jeff can answer that.
Yeah, well, yeah, it's a tough question, and Jeff Rich, who's asking it, is an engineer that was one of the major players in building all the things that I just mentioned about Gundersen. The reason we were successful, his hard work, brilliance, and capability to work with so many people. I would say for the group that there are a couple things that are pretty important that would make a lot of difference. One is the regulation of the power systems now is built remarkably in favor of the power generation legacy systems, and to absolutely make sure that they have everything they need in the case of a 1 in 1,000 event. And I think the balance needs to come back more towards a community-based, community in the whole state-based approach to say what is good for all of us, not just the power companies as a primus. We have to keep them as in the mix. I agree, but I think the balance is off cue. I think the other thing would be to recognize all the benefits that are given to fossil fuel systems now, to understand all the tax activities that go on to benefit fossil fuels. And we can't get rid of the fossil fuels tomorrow. I mean, that whole system would crash. You can't do that. But again, to recognize the cost, to say, well, this, $1 billion for solar is, it's unfair because they're getting a subsidy, when, we're subsidizing fossil fuel to many more times that, and the cost on the health of the population of using the fossil fuels is enormous and doesn't get figured into those pieces. So the legislature has to broaden their view of cost and impact so that we get a fairer picture, and so that the competitive landscape is clearer, and that we can actually build a future that serves the public broadly. It doesn't happen overnight, but we have to start making those balances to get us in the right direction.
Thank you. Claire, would you like to weigh in on that question? I think you're on mute.
Okay, sorry.
Go.
Yeah,
Perfect.
I just wanted to add on to what Jeff had to say with, it's somewhat the political will of the state, unfortunately. But if there was recognition by more legislators that renewables are an economic plus for Wisconsin, we'd save money, and it would create I think 167,000 jobs is what the ABLE study said. That same study I quoted as far as the health impacts. And so, if there was more open-mindedness, I think it's a matter of those legislators that are, putting politics first rather than economics, the real economics of this, how much money the state of Wisconsin is spending on fossil fuels. We could be creating more renewables in our state. How we get there though is the problem. How do we do that? We're chipping away at it, I do believe, but and we have, there's community goals and there's a state goal, try to get off fossil fuels by a certain point in time. And, I have to mention the governor's task force on climate change. We all had weighed in on that. I can't remember how many pages that thing was, but it wasn't that much. It was only like 50 or something. It could have been, 1,000 pages of all the things we could do in the state, because, we've done some analysis of that, and there's way more things that we could do. But it takes coming together, by the, all sides of the aisle, so to speak, and seeing this as a vision and not fighting, and seeing it as a win-win for everyone.
I think that's very important. Let me just add to give an example, exactly what Claire's talking about. I don't think we write anybody off. We say, how do we broaden the tent? What do we find out? What's important to them? How do we make this work? So the previous Governor Walker, probably not known as a great environmentalist around the country in most circles, but when he was very interested in what we were doing at Gundersen. And when we put in a biomass boiler, we were talking to his staffers come down, and we framed it and said, okay, we're currently getting natural gas from Texas and coal from Wyoming. If we could rather save money and burn otherwise unused wood chips from Wisconsin in a very high-tech biomass boiler, wouldn't that be something the governor would be excited about? He was very excited. He came down to the groundbreaking, he came down when he opened it. He was very excited about it on the principles exactly as Claire mentioned. It is saying, what is going to make sense? Now, I mean, the story was broader in that we were able to put a turbine in front of that biomass boiler that would drive electricity. That electricity could be used to drive a giant geothermal heat pump system. I mean, it decreased the dependence on external, outside Wisconsin energy sources, save money, lower the cost at Gundersen, and markedly decrease pollution.
And adding those renewables to the grid can also, associated with the health system or with other commercial entities, that can help stabilize the grid as well, saving both utilities and consumers money. So that's extremely valuable. So the conversation has gone fast already. We're close to our 1:45 stop time, but I wanted to take a moment and thank our sponsor for this session, that's CED Green Tech. Very generous sponsor for this summit, and we're excited to have them here. And thank you to our speakers. And I'm so thrilled by this conversation. And as I mentioned, at 2:00, Wisconsin Health Professionals for Climate Action, Dr. Andrew Lewandowski will be continuing the health renewable energy conversation. So pop back in, but we have 1 minute each. If you can tell me what you're looking forward to with your work on renewable energy and health in 2021, that'd be great. And I'll start with Allie.
Yeah, I think what I'm starting to learn is many of the communities that we serve, we are one of the largest employers and one of the largest energy needers, or users, is maybe a better word. So I think there's significant partnership there, in partnership both at the utility level, but potentially our community level. So I'm excited to see where that goes. And I'm really excited to see where we go with some of our supply chain and transportation efforts as well.
Thank you. Claire, would you weigh in?
Sure. Yeah, there's a number of goals. I work with the sustainability department at UW Health, and we're at the level of having done a lot of energy efficiency. I can't take credit for that, but I should say UW Health has, under the leadership of Mary Stotz. And we're sort of on the brink of talking about renewables with MG&E and how we can make that happen more. So we're working on that. And then Wisconsin Health Professionals for Climate Action and some other groups are excited that Oak Creek Power Plant is going to go by the wayside in the next year or two. And there's some talk about, could there, be other coal plants that we could work on, trying to have, put the pressure on to have those get closed. So that's what I'm looking forward to this year.
Thank you. And Jeff.
I'm looking forward to using the Practice Green Health and Healthcare Without Harm US platform, along with Healthcare Without Harm Europe, which I'm working with their board now, to rise up the stories of people like Allie and Claire, who despite the pressures of the economic downturn, despite coronavirus stuff, are still moving ahead in this area and showing that we can do more than one thing if we focus on the purpose of our organizations, that true mission. We have so many people at various parts of their career from various backgrounds that are inspired by this work, that despite all this other struggles, we can still make huge progress because of so many people like the folks you see, like many listening in, who are willing to take this on and move this ahead. So I'm pretty optimistic that we will make great progress in 2021.
Yes, and I wanted to thank you all as being direct healthcare providers and supporting healthcare systems, and to all the attendees who are working in healthcare. This is, I'm sure a very, very difficult time, and we just want to thank you for your service. Thank you for being here today. We'll see you at the 2 o'clock sessions.
Thank you, Heather.
Thank you. Bye now.
Bye-bye.